About 10% of 911 calls across the country involve mental health situations, and in a lot of cases, officers are not trained or equipped to safely handle them. The Huntsville Police Department is working to equip officers to handle these calls the best they can. Our Sydney Stallworth got an inside look in this week's Mental Health Monday.
If you have a love for kicking in doors and being a SWAT guy, be a SWAT guy. If you want to chase drugs, be a STAC guy. If you want to help people with mental illness, then you come to the CIT.
Officer Johnny Hollingsworth is the training coordinator for mental health and crisis intervention team officers with the Huntsville Police Department. He tells us about the training some officers go through to become CIT certified.
Over a 40-hour period, we have approximately 26 different blocks of training. And each one are specialized, whether it's on suicide, whether it's schizophrenia, mood.
Officer Hollingsworth brings in experts and people in recovery from local groups to speak with officers.
Like NAMI Alabama, NAMI Huntsville, Wellstone, and different organizations.
Hollingsworth tells us the training is ongoing. HPD aims to have about 30% of officers trained as CIT. We're told the rest of the department gets mental health training too.
Chief McMurray wants them to go through a 16 hours introductory to mental illness and introductory to CIT. They do learn de-escalation skills, but what this does, give them the tools to calm everything down, realize that they're dealing with something that is mental illness, and have the time to bring a CIT officer over there.
Officer Hollingsworth tells us HPD has been working on improving the way it handles mental illness situations since around 2004, but the Department of Justice Valor Grant has helped them move much farther ahead with plans for the future.
Currently, after 5 o'clock, Monday through Friday, and weekends, our resources are very limited. Reality is our main resources is going to be the Huntsville ER or the jail. Unfortunately, if you're talking about suicide, if you're being helped at an ER where you're having trauma patients come in, that's going to upset you. And so we've been working with Wellstone, and here recently we were one of 3 in the state blessed to get the receiving center. Also, one of the great things that Wellstone done is that they helped us develop a telecommunication program, certified clinician that can Skype with certain ones of our CIT officers.
Officers can get real-time advice in the field and let people speak to clinicians on site.
Our department has always been looking at community policing as a standard, and we don't know everything. We need to hear the community. We need to know what they need, not what we think they need, but what do they need. And if we can give it to them, we should.
Putting the Valley first, Sydney Stallworth, WZDX News.